Let's explain to them a little of what CIT does and how they serve our community.
Montgomery County 911, what's the address of the emergency?
Welcome to another episode of Voices of Service. Today, we are bringing together voices from two important stakeholders to discuss an incredible partnership. We are joined by Sergeant King of the Crisis Intervention Team and Beth Tabashnik of Health and Human Services to discuss their unique partnership and the crucial work they do in responding to crises throughout our community.
So this is cool because we're not interviewing anyone from secret locations this time. You guys can actually be seen. And I know both of you all from going way back. Beth, I know you way back. I know we're not going to talk about CIT right now, but back in the day I was overseeing CIT and I taught at this class that we do. It's a 40-hour class. I had a lot of fun teaching in that class because seeing you all, what you do, trying to get knowledge to our officers on how to deal with these things. Yeah. JJ, obviously great family name, right? And history in Montgomery County Police, but you and I have been honor guard, we've been everywhere together.
Yep.
How long you been on now?
Almost 18.
Almost 18. Okay. Gosh, it seemed like it was yesterday that you were like a little youngin'.
Yep.
So, well, good. Well, you're in an important position now, and the work that you're doing is great. So let's get to it.
All right. Well, I know that CIT and HHS is the way that it looks right now is new. However, you guys have a long-standing history, right? So in order for our community to understand, let's explain to them a little of what CIT does and how they serve our community.
Sure. And thank you for the opportunity to be here. The Crisis Intervention Team we have 5 full-time officers who are deployed geographically throughout the county, 1 officer in every district. And our responsibility is to pretty much bridge the gap between mental health and law enforcement. Yeah. And Chief Frank has been a huge proponent of it, ever since I came on. And what's great about the CIT team is, and we'll go into it, is we work collaboratively with HHS. We are actually now co-located at the Crisis Center in Rockville, which is great because it allows our officers who are dressed like this in a more approachable uniform to work side by side with LCSWs, or licensed clinical social workers, to address those in the community who need our help the most. So the mental health consumers, those with acute problems, we're able to meet them where they need us instead of them coming to us. So it's a great resource and a great partnership.
And this is a good expansion because going back to Beth and I, before it was just Davis and Chinbloom.
Right.
And you all were working at a headquarters, and now we've taken it to the field, if you would, and we're trying to do more and more.
Absolutely. Now, HHS, what do you guys, how are you guys serving alongside our officers, but also how are you serving alongside of our community?
So my home within HHS is at our 24-hour crisis center, and we are an essential service to the county. Our staff are there, as I said, 24/7. We never close. And we provide the gamut, the full continuum of crisis services. So we have our crisis phone lines that are available 24/7. We have walk-in services at our main office at 1301 Picard. And we have our residential crisis services, our crisis stabilization services, and then perhaps most relevant to our partnership with CIT, we have our mobile crisis outreach teams. And we have similarly seen expansion over the past several years, somewhat unprecedented expansion. When we started, when Mobile Crisis first started, we were running an operational with 1 team, only 8 hours a day. We are, of course, now 24/7, and we also have regional teams up and down county in Silver Spring and Germantown. So we've been able to expand to meet the needs of the community and provide a faster response time, over the past couple of years, and we're also continuing to anticipate further expansion. So we've been, as Sergeant King was saying, we've been partnering with CIT for a long, and AC Frank was saying we've been partnering with CIT for many years, and we've responded to probably tens of thousands of calls with our, if not even more than that, with our MCPD, with our local law enforcement partners. And we've been very fortunate to have such a strong partnership and such a good relationship. And we've benefited from having the CIT expansion as well. And I'm sure we'll talk more about that.
Well, how did that partnership start? Where did it begin between the two of you? Well, not the two of you, but the two, CIT and HHS. How did that partnership begin?
Do you want me to?
Yeah.
I was going to say I can probably, actually, perhaps Chief Frank would be the best person to tell that story. But we actually were really trailblazers in terms. We really jumped in at the infancy of the CIT program, of the national CIT program, international CIT program. Way back in the day, Chief Moose was a huge proponent for it, and developed a team, sort of a task force, if you will, of individuals from the police and from the crisis center to go out to the conference and do some training and really learn the model. And this was back in 2000 that we started having our first CIT classes. Yep. And it's grown from there. We have held at least four 40-hour classes each year since, and have developed the curriculum. And
it's a week-long class, like 40 hours, week-long class. Officers are there getting taught by clinicians.
Yeah.
We go to visit
hospital facilities.
Yep, we visit hospital facilities. We talk to people that have had, experience. The block I taught is about things. Actually, the way I always posed it was when things go terribly wrong, but you did everything you possibly could.
That is it was an incredibly important lesson to include in that class. Yeah, we were lucky to have AC Frank teaching.
Well, you guys give so many tools to our officers, and that's the thing that we can't get lost, right? You give so many tools to these officers. People want to say that officers aren't trained in dealing with folks that are in mental health crisis, and I appreciate you saying it. We were at the front of the pack. We developed a national model on this class on teaching officers, and now we're kind of taking it to the next level as far as the co-response, right. Which again, that's a unique thing too, and how you manage it. It's difficult to manage, right? Because you're not trained in safety issues,
right?
As far as personal safety. Yet, JJ King has gone through our academy. Marine too? Brother? Yeah. See, I remember these things. Okay. You said I haven't had enough coffee. I tried to give you the Marine moniker, but
I got you.
I tried to. JJ's been through all kinds of safety training and knows how to, control situations to make sure everyone's safe. So, it's not that we can just send the clinicians out to do this work, unfortunately. We'd love to, but there has to be space for safety for you all, right?
We've been very fortunate with our partnership with Montgomery County Police and also our municipal police departments over the years. We've really relied on officers, both for our safety and the safety of our community members as we've done these evaluations, and, we've been in some of these very complex situations. And your point is 100% accurate. We strengthen each other in terms of our knowledge, skills, and experience. So I've had the privilege or luxury of working a little bit more directly with police over some space of years. So I was privy to observing some of the training. And
I know. I mentioned I actually thought you were an officer when I first came on. I had no idea that you actually weren't. You were at all the trainings. It was.
That's a huge compliment, so thank you, that I was able to pull that off. But no, I'm a licensed clinician, but I did learn so much just from being in the same space and having these daily conversations with my partners. And similarly, we have the opportunity to enhance our partnership and the communication between our teams now. And so I think this is a huge benefit to the community and the clients we serve. They really we benefit professionally from strengthening each other's skills and knowledge, and then also the community members benefit from having that strong, partnership between departments.
Yeah, absolutely. Now, I know you said you are now exist in a co-location, right? And so how do you see that strengthening you guys, just being there together?
Yeah, absolutely. So in year 2022, I think the statistic was there were 8,600 mental health calls that were cleared mental health by the police department. And so with a team of 5 officers, that number seems impossible to give each person, each mental health consumer, the attention and time they need. So what's great about the CIT school that we put on the 40-hour block, plus the collaboration with HHS, it's absolutely a force multiplier. So the county police, in conjunction with HHS, can meet the needs of the community out where the community is much quicker, with not only the resources but the education behind it. So in the class we learn about auditory hallucinations, visual hallucinations, different diagnoses and stuff. And what's great about the course is not only HHS teaches it, but we have our partnering agencies coming through. So we've had all the municipalities within Montgomery County, but also I reached out to Montgomery College because they're such an important part of the community, and the majority of our young people who are now going away from school are experiencing some mental health crises at that time between 18 and 25. Yeah,
that's okay. That's what I was going to say.
And also I think one of the neat things about you all's unit is, so you all are the most highly trained we have of the CIT folks, right?
Right.
Our officers have a lot of training, like 800 officers trained in this, right?
Correct.
But you all have a much higher level. So one of the things that we do see, right, is there are people that have issues more than others. So we're able to take those people that are more frequent callers, or more frequent users, and we can have you all's co-response, which really I don't think people understand. Like, it's such a struggle. And I learned this through class. I paid attention. It's such a struggle because there's not enough resources out there, and they don't know where to turn.
Right.
And so you all know where to turn, and you can give it more time than a patrol officer can.
Yes.
So you guys keep getting those. So I think that's a neat component of what we do to try and get people help.
Absolutely. I mean, the beauty of this, if we're doing it effectively and well, is that we're, hopefully we're a resource to put, for officers on patrol, that we're able to shift some of their focus to things that require their attention. And obviously with with our team collaborating with CIT, we can address some of the situations that are a little bit more acute or a little bit more complex, or that may have some particular complexities is probably the best word. But our goal would be to allow officers to focus on what they need to be focusing on and absorb the the task of providing these resources to clients in the community. And that's like you said, we have the luxury of time and access to resources that officers may not be aware of, or even if they are aware of, may have other things that are more critical at that moment.
Absolutely. I just want to go back really quick to the amount of calls that we receive that are of individuals who are in a mental health crisis. Now, do the majority of those calls come from dispatched police calls? Do they come to the crisis center? And how do you kind of decide which ones that this team is going to respond to and those that officers who have received training are going to respond to?
Great question. It's a complex kind of situation where, through different law enforcement databases, but also HHS databases, we're able to, as Beth said, kind of identify the more acute consumers. In addition to that, Montgomery County Police has spun up and has developed what we have named the Behavioral Assessment Administrative Unit, which is also part of the Crisis Response Support section. So that unit is responsible for kind of looking at the breadth of calls for service, identifying those consumers who are in the most need, and then that comes through HHS. But in answer to your question, we get it from all sources, whether it's 911 calls, people emailing, HHS referrals. So it's all encompassing.
Yeah, it's interesting. You talk about the creation of that unit, right?
Yeah.
We talk about expanding the number of officers we have in CIT, and we talk about expanding our crisis center teams. We're doing this at a time where we can't hire cops, and we can't hire clinicians either, right?
Challenge.
I've been
Yes.
I've been in all the meetings
Many
with Dr.
conversations.
Santiago,
Yes.
talking about the challenge of hiring people.
Right.
I know a little bit too much about the challenge of hiring officers. But I think the nice thing about Montgomery County, and we're listening, and we're just not throwing our hands up and saying, "Sorry, we don't have enough people to do that." I mean, we recognize the need. We're doing our darndest,
Right.
Yeah.
right, to get the job done. And when those calls kind of, because that's another way we get the calls at ECC, and then we have a matrix it goes through, right? It talks about if there's been violence in the past, if any other issues, and then we make a determination. We do that warm handoff.
Right.
Can we give it to just the clinicians?
Yes.
Because we do have that as an option. You all do that.
Absolutely. And that's, I think, again, in terms of making the best use of our available resources, because they are precious right now, and also kind of figuring out what the best response would be for a given situation. Certainly there are calls that come through ECC or are dispatched to police, and the officer may arrive at a scene or talk to an individual and be like, this isn't really a police issue, matter, or this isn't really, maybe HHS or the crisis center would be a better resource in this situation. So they're able to hand it off to us. They can call. Sometimes we can assist over the phone. Sometimes the officers will bring people into our office, or sometimes we send our mobile crisis teams out. And if it's a situation that doesn't require police attention or it's not necessary, we can respond without having to use their time. But there are other situations that are a little bit more complex. We may receive a call, or perhaps the IT receives a call, or the behavioral assessment unit, and we recognize, like, okay, this situation it does require a little bit more, maybe communication or planning or preparation, and that's where we really, we hope that the clients in the community really benefit from our partnership. And again, similarly, or in that vein also, hopefully taking away some of that responsibility from officers on shifts who have other responsibilities.
I think it's,
Sorry, go ahead.
may I interject? I think it's also important to note that on the most volatile calls that we call ERT callouts, so emergency response team callouts, that CIT is deployed with as a resource, and Beth is almost always on the phone to help the negotiators to try and de-escalate obviously a very volatile situation as quickly and safely as possible. So it's a fantastic collaborative effort, even in the most trying times.
Right. We are very willing to have mental health clinicians available for whatever role they might serve, in a given situation. Sometimes that's as consultant, sometimes that's as a, resource for family or impacted individuals in the community, or it might be doing, in some situations, a direct assessment. So we will have that conversation and decide the best approach.
Yeah.
Yeah, it's really an amazing partnership, a relationship that you guys have formed. That's phenomenal. I know we're running low on time, but I just have one question for you. So knowing that the CIT, it's longstanding, but it's kind of changing all the time. What is it like for you to be a sergeant of a unit like this?
It is a exciting and humbling opportunity. I work with a great group of people who are of diverse backgrounds. I have a former pastor. I have a former, I don't think she was licensed social worker, but she worked with HHS. one of my officers is also an immigrant from Cuba, came when he was 19. So we have a very diverse group who not only background, but also religious preferences, sexual orientation. So we represent the community very well, which I'm very proud of. Our crisis intervention team school is always progressing. We're actually using VR headsets now to put us into what we just started last class, to go into the body and the experience of someone that's in a schizophrenic, having a schizophrenic breakdown. And so it allows our officers to kind of embody what they're experiencing on the street and try and see it from a different point of view. So it's a very exciting position to be in.
Now you're saying they actually get to step inside of the shoes or the body, so to speak, of the individual experiencing that crisis.
Yep.
It's neat. You got to do it.
Yeah.
I did it.
You did the actual virtual reality?
Oh yeah, I did the virtual reality. I had the goggles on and everything, kind of wandering around. It was cool.
Yeah.
But it was also it was eye-opening to see what those individuals experience and why they aren't going to listen to me and this guy.
Because there's so much
going on. In just a few examples. It's kind of neat, and we're rolling it out to the rest of us.
Yeah.
You should do it.
Yeah, absolutely.
We'll have to get you a demo.
Yeah. I remember back in the day, I suppose, we would put on the headphones, and you would hear, and you would go through it, and that was difficult for me, right?
Yes.
But it also gave me such an empathy when I responded out to calls, and I was trying to communicate with somebody, and they weren't necessarily listening to me, but I got to understand why. Right? It's huge. It's absolutely huge. Well, do you have any other questions?
No,
Chief?
I've harassed JJ enough. He's been nervous about this encounter for 3 weeks. I had to, chide him about his brother a little bit. But,
I'll see you next Monday.
yeah. Okay.
Well,
very good.
Thanks.
Sarge, Beth, thank you guys so much for being here with us. And for you, thank you. Stay connected, stay safe, and we'll see you next time.